All right, welcome back, everyone. I'm super excited. Now we're actually going to start talking a little bit more medical stuff. So I know it's more exciting for me. Hopefully, it's a little more exciting for you. Chapter 6, as we move into it, this is looking at the human body. So we're going to specifically be going through the different systems of the body and trying to get a basic understanding of each of those systems. So we're going to be looking at anatomy and physiology and using knowledge of anatomy and physiology to kind of understand the airways, the heart, the blood vessels, the lungs, our bones, all of the different systems. Then we're also going to talk about lifespan development and how the body can change as we age. So a little bit of an introduction. We need to be able to understand and know the basic structures of the human body in order to be able to do a proper assessment, in order to understand what's going on with our patients. And so we have to have that foundation before we can move into trying to figure out the ins and outs of different disease processes or injury patterns. So that knowledge is going to help us specifically as we perform adequate assessments, like I said, and communicate the findings of those assessments to other medical providers. So we're going to look at first kind of understanding some terminology about the anatomic terms that we use when we're talking about the body. And so first I want to point out, and we'll talk about it in another slide, but this is a good picture for us to look at. This picture here is the anatomical position of the human body. So when we're talking about the anatomical position, this is what we're going to be talking about. The patient's going to be standing, facing us, hands out to the side with the thumbs out. So the first kind of term that we're going to talk about a little bit, so we have our anterior. Anterior is just the front. So everything on the front. Then we have posterior, which is our back. And then from medial towards the midline, then we have our lateral, which is out away from the body. Distal is farther from the heart. So the distal ends of our hands or our feet, more proximal as we come closer into the center. The next one that we have is superior. Superior is more towards the head, and inferior is towards the feet. So if you're hearing somebody talking about anatomical positions of an injury, those are the terms that they may be using. It's important to know that if you forget these terms, you don't need to try and make it up, or it doesn't really matter, okay? You can say their front or their back or farther away from their body. Like, you can just use normal, simple language to describe these terms. But as you continue in the field, you'll want to start to understand these as they will be used by other healthcare providers. So like we talked about, the standard anatomical position is the position of that figure in the last slide. Anterior is the front surface, posterior is the back surface. Midline refers to kind of this imaginary vertical line drawn from the head down, cutting the body in half. Just going through all these once again. So medial, closer to midline. So coming in, lateral is away from midline. Proximal is close, so we're looking closer. Once again, distal is distant. Superior, closer to the head. Inferior, closer to the feet. So the first system that we're going to talk about is going to be our respiratory system. So the respiratory system is everything that we need to get oxygen into our body, to transfer the oxygen from our lungs into our vessels so that the blood can transfer it around the body, and then exhale the CO2. So this first diagram kind of looks at the respiratory system and breaks it up a little bit. So we have our upper airway, and our upper airway is everything from the glottic opening up. So it's going to be our nasal airway, our oral airway. Then we're going to have our trachea, and that breaks down. So as our trachea comes down, then it branches off from the carina. The carina is kind of that break off point where we have our left and our right bronchus that enter into our lungs from there. And it just continues down into smaller and smaller branches. And then the diaphragm is part of our respiratory system as well. Looking at this, our airway consists of our nose, nasopharynx. If you remember from our previous chapter, talking about some of that medical terminology and those prefixes, we have naso, nose. So we have our nasopharynx, we have our mouth, which is our oropharynx, we have our throat, our larynx, our trachea, and then the passages within the lungs are our bronchus. Another little quick picture here, just looking at the respiratory system. It's looking at the nasal cavity, the mouth. So it's important to kind of know some of the things that are happening within our respiratory system, starting at the upper airway. And we're supposed to be breathing through our nose. And the reason for that is within our nasal passages, we have little turbinates that help to humidify and warm the oxygen that we're breathing in. When we breathe through our mouth, we lose that ability to warm and humidify the air that we're breathing. So it's one of those things that we can look at and pay attention to. And then we all know that we have our mouth, that as we start breathing heavier, sometimes we'll open our mouth so we can get a little more air in. Once we start looking farther down into the respiratory system, we start looking at the lungs. And this is where the oxygen and the carbon dioxide actually exchange from the lung tissue in our alveoli into the capillaries. So our capillary network wraps around each of these grape-like structures, or the alveoli, and so the air can pass through those membranes. The process of our respiration, or moving our air in and out, is by using our diaphragm and our muscles in between our chest wall. And so as we inhale, our chest expands and the air is able to come in. And then as we exhale, everything collapses back down. So the way we actually breathe is by creating that negative pressure. So as our muscles expand and create that opening within our chest, it's able to draw the oxygen in, and that's how we're able to breathe. So that's our quick overview of the respiratory system. Now we're going to talk about the circulatory system. Circulatory system is our heart and our blood vessels that pump the blood around and around. So the blood flow, the blood picks up oxygen in the lungs, goes to the heart pumps that blood through the rest of the body. The cells absorb the oxygen and the nutrients that they need as the blood is circulating. They hand off the waste products from cellular respiration back to the blood, and then that blood circulates back to the lungs, carries that waste back, and it's either taken to our lungs or our kidneys for the waste to be excreted. And then carbon monoxide or carbon dioxide changes for more oxygen, and the system continues round and round again. The heart has 4 chambers. We have our upper chambers and our lower chambers. Those upper chambers are called atrium, and the lower chambers are called ventricles. And they work together to pump blood first to the lungs, and then from the lungs back, and then to the rest of the body. So within there and between each of those chambers, there's like a one-way valve that allows blood to flow through, but not to flow back. And you'll be able to kind of see some of those here. So first we have our right atrium up here, and our blood flows from the right atrium down into the right ventricle. From the right ventricle, it goes up into the pulmonary arteries to our lungs. And then from the lungs, it's going to come back to the heart through the pulmonary vein into the left atrium. It's going to travel from the left atrium into the left ventricle. And from the left ventricle, it goes up through the aorta and to the rest of the body. I'm sure everybody's heard arteries and veins and trying to figure out which is which. Um, Arteries carry blood away from the heart. So for the most part, that means it's carrying oxygenated blood. Um, the only exception to that is pulmonary arteries that carry deoxygenated blood back to the lungs so that they can become oxygenated. And then the pulmonary veins drop back into the heart. So the pulmonary veins are carrying the oxygenated blood that is then sent through circulation to the body. So we have three kind of main arteries in our body. First, we have our carotid or our neck arteries. We have our femoral arteries, which are the ones in our groin. And then we have our wrist or our radial arteries. There's a lot of other arteries, but those are the ones that we really talk about specifically when we're doing our assessment on patients and looking for points in which we can check for a pulse. And so those ones are easy for us to actually feel and feel the blood pulsating through our bodies. So here you can see a little diagram. This is pointing out where those carotid arteries are, where the femoral arteries and the radial arteries. Everything that you see in this diagram is actually an artery, and depending on the patient you're doing assessments on and what's going on with them, you can actually check for pulses in multiple locations based on using the anatomy here and looking at where these arteries are located. So our arteries carry blood away from the heart and towards the tissue. But once it gets to the tissue, it needs the ability to actually get to the cells. And so from there, it gets transferred down to smaller and smaller vessels, and these are called capillaries. And these are the smallest vessels that we have, and it's a very thin wall in which the blood can move through, and it can bring in the waste products from the cells, and it can exchange the oxygen and nutrients that it needs to. There are many different components of our blood. We have our plasma, our red blood cells, our white blood cells, and our platelets. Each of them have different roles. Our red blood cells are what's carrying the oxygen to our cells and then carrying the carbon dioxide back. Our white blood cells are helping us fight infections, and our platelets and our plasma, those are what help us with our clotting as we have different injury pathways that cause us to bleed. So the next system we're going to do an overview of is the skeletal system. So this is just the bones and the connective tissue that make us who we are, make us be able to stand upright and move around. So there are three major functions of the skeletal system. It's to support our body, actually hold us up. It protects our vital structures. So like we have our ribs and everything that protect our lungs and our heart. And then actually our red blood cells are manufactured in the skeletal system as well. Little diagram here of the skeletal system. You're able to kind of see some of the different bones. We have our skull, we have our shoulder girdles, clavicle, scapula. Some of the things that we'll talk about later when we get into our splinting and some of our traumatic injury sections, we'll be talking about some of these different bones, the different injury patterns, talking about the pelvis and some of our long bones and how to splint all of those different things. So starting from the top, we're going to talk a little bit about the skull. The skull is the bones of the head, including the jawbone. There are many bones within the skull that are actually fused. Those suture lines from when we're kids, our skull is able to collapse in kind of on itself as we're born, as we move through the birth canal. And then as we grow, those suture lines that allow the skull to flex start to fuse and close together. And that helps us to protect our brain. But because of that, in kids, you will notice they have soft spots as those bones have not formed completely and haven't fused together yet. And so there are points where you can actually feel inside the head and even to their brain. Cut that. We don't need to talk about the brain. And then the jawbone is the movable bone that attaches, and that's how we're able to chew and eat, speak. Moving down from the head, we have our spine, our 33 vertebrae. We have our cervical vertebrae. We have our thoracic vertebrae. We have our lumbar, and then we also have our sacral. The spine has muscles and tendons and ligaments and all sorts of things that help us to articulate each of those vertebrae, help us move, help us be able to do the bending and twisting that we do. Within the vertebrae, there's a hollow channel, and that's actually where our spinal cord passes. So the spinal cord is attached to our brain, goes down through our vertebrae, all of our nerves come off of there. So if you want to think about it this way, our brain and the spinal cord are who we are. Everything else is just the robot that the brain is moving around. We talked about this, our cervical spine, thoracic, lumbar, sacrum, and then I had forgot to mention the coccyx, which is the tailbone. And here you can see kind of a breakdown of those different regions. The next thing as we move down is going to be our shoulder girdles. Each shoulder girdle supports the arm, helps us be able to move, and there are 3 bones in there. So we have our collarbone, which is in the front, that's our clavicle. We have our shoulder blades in the back, and then our upper arm bone is our humerus. So those 3 bones combined constitute the shoulder girdle. And then what we call our upper extremities is just our arms, and there are 3 major bones in that as well. So the 3 bones that we have in our upper extremity is going to be the upper arm bone, or our humerus. The forearm has the ulna and the radius, and then we have our wrist and hands that have several more bones, and they are all part of our upper extremities. The rib cage protects our heart and our lungs and our liver and all of those other vital organs. So there are 12 sets of ribs, and they connect to our thoracic vertebrae. So there's one for each of them. Here you can see that as the ribs come around, they are connected in the front by our sternum, located at the front of the chest. And then at the bottom of the sternum is the xiphoid process. This is kind of a pointed structure that sits just at the bottom of the sternum. Next major part of the skeletal system is our pelvis. This is the connection point between our upper body and our lower extremities. It protects our reproductive organs, as well as other organs that sit in the lower part of our abdominal cavity. And then we move on to our lower extremities. Our lower extremities are our legs. So we have the thigh and then the leg. The thigh bone is known as the femur. It's the longest and strongest bone in the body. And then as we move down to the lower part of the leg, there are 2 bones. So just like in our forearm, there are 2 bones in the lower part of our leg. We have the tibia and the fibula. The kneecap, or the patella, is the articulating point between the femur and the lower part of our leg. It's a small flat bone. It sits right on the top. You'll be able to feel it and protects that articulating movement. We also have our ankle and our foot, which, just like our hand, has a number of smaller bones that help us to be able to articulate and do fine movements. So we've been talking about joints. Joints are just where 2 bones come in contact with each other. At the joint, the bones are held together by connective tissue. These are the tendons and the ligaments. And then there's a small lubricated sac in between those 2 bones, so that we're not rubbing bone on bone. But that small lubricated sac helps to allow the movement to be more fluid. Here you can see that there are different types of joints. So we have the first picture there is kind of our ball and socket joint. And this is going to be in our shoulder girdle, right? This allows us to articulate in many different directions. The next that we have is our hinge joints. Hinge joints are like our elbow or our knee. They kind of only work one direction. And then the next joints that we have are fused joints. And these are going to be things like in our sacrum, in our coccyx, and also those fused plates in our head that we had talked about earlier. So attached to our skeletal system, we have the muscular system. Skeletal muscles help and provide the support that we need to actually stand up and to move around. They're able to provide movement through contraction and relaxation of different muscles that work in concert together. We also have in our body smooth muscle, and these are kind of, they call them involuntary muscles. It's things that just kind of work. When we think about smooth muscles, one of the things that we think about is like our digestive tract. And those muscles, they just have their own kind of movement to them. And we're not actually thinking about how they move and what they do. And the next kind of muscle is actually cardiac muscle. Our heart is a muscle, but it's its own special type of muscle. So cardiac muscle is only found in the heart. It's adapted to just function and work all the time. It has a very rich blood supply to it. And the cool thing about it is, like skeletal muscle, we have to think about what we're moving and doing. There has to be an impulse that says move this muscle. And with smooth muscle, it just kind of involuntarily does its thing. But there has to be some type of impulse. With cardiac muscle, it can actually generate its own impulse. So that's one of the fascinating things about the heart, is it's able to just continually work. And if it doesn't get an impulse from a nervous system somewhere else, it's able to create its own impulse. The nervous system, we briefly talked about as we were talking about the spinal cord, but the nervous system is what governs our entire body function, everything that we do. So the nervous system is our brain and our spinal cord, and then the individual nerves that extend off of that, that tell our body to move in certain ways and what to do. There are different areas within the brain. We have sensory and motor. Our sensory nerves are what send signals to the brain. We're able to touch and feel and send that signal up to the brain so it can interpret what it's doing. And then the motor impulses are what tell us to actually move. So we think about the brain, it's just a very complex computer that's controlling everything we're doing. It controls our thinking, our voluntary actions, as well as our involuntary functions. We talked about the spinal cord. As it goes through the vertebrae, it's just a long tube-like structure that extends from the base of the brain and goes down through our vertebrae. Next, we have our digestive system. This is what breaks down our food, carries the nutrients into the circulatory system so that the nutrients can be spread throughout the body to all the cells. Food that is not used for energy is eliminated as solid waste. And all of those major organs of the digestive system are found within the abdomen. The digestive tract starts kind of in the mouth, really, but it starts with the throat, goes through the esophagus, from your esophagus into your stomach, to your small intestines, your large intestines, and then on out the backside. The little diagram showing you some of the parts of the digestive system. There are also other organs, so we talked about the stomach and the intestines, but some other organs that are part of the digestive system include our liver, our gallbladder, and our pancreas. The liver produces bile that helps to digest and break down fat, and the pancreas is specifically responsible for the production of insulin to help us regulate our glucose. And that one's going to become important as we talk more about some of our medical emergencies. A lot of what we deal with is going to be related to insulin and glucose production. So next, we have the genitourinary system, the genitourinary system. This is responsible for reproductive functions and for removal of waste products. So the main organs that we're going to have here, looking at the male reproductive system, is going to be the testes, which produce the sperm, and then the penis, which is the delivery system for the sperm. Then we have the female major reproductive organs. So we have the ovaries, which are producing the eggs, the uterus, which is meant to hold the fertilized egg and the fetus through pregnancy. Eggs are released by the ovaries, traveling to the uterus through the fallopian tubes. And then the external opening of the reproductive system for the female is called the birth canal or the vagina. This also includes the removal of waste. And so from our kidneys, we have waste products that come in. It is filtered out of the blood and into the urine. Urine flows from the kidneys down through the ureters into the bladder. The bladder is the connection. The bladder is the collection point that stores urine before it passes out of the body through the urethra. A lot of people don't think about this, but the skin is actually an organ as well, and is one of the systems that we need to pay attention to when we're doing our assessment. So the skin covers all parts of the body. It has three major functions. The first is to protect against harmful substances in the environment. The next is that our skin actually helps us regulate our body temperature. And then next, as we talked about our nerve endings, is it transmits information from the outside world to the brain. So there's different layers of the skin. We have the dermis, which is the deeper layer, and then the epidermis. Here's a little diagram showing you the different layers. So you can see the epidermis is kind of a thinner layer on top. And then once we get down into the dermis, that's where you're able to actually see that we have nerve endings. This is where our sweat glands are. We have our adipose tissue, which is our fat. And then our blood vessels, our arteries and our veins are in the dermis. We talked about before protecting ourselves from bloodborne pathogens or airborne pathogens. So the skin is an effective barrier to help protect us from bacteria and viruses as long as it's not broken. And that's one of the reasons why we wear gloves, is if we have any exposed or broken parts of our skin, that's an entry point for those viruses and bacteria to get in. Our skin, as we talked about, this is where our sensory nerves are. So it helps us perceive touch and pressure, and to tell the difference between hot and cold. So that's a brief overview of all of the body systems. Now we're going to start talking a little bit about stages of life and our growth and development. So throughout our life, our body is changing little bits. And some of the main things that we need to pay attention to with that is we have things like in an infant, their airway is substantially smaller and not as well developed as it is in an adult. And because of that, they are prone to have obstructions or swelling or different things that close off that airway. And we have to treat them differently than we do an adult. As our little guys get a little bit older, they become toddlers. They start toddling around. They start bumping into things. They have poor balance. They're at a higher risk for falls. Their head is a little bit heavier and bigger compared to the rest of the body. So when they do fall, they tend to go head first. And then we get into our school age children, and now we've moved into different injury patterns. These kids are physically active. They're out riding their bikes around. They're playing on playground equipment more. These children are involved in athletic activities and different things. So the injury patterns that we start to see with them is going to start to change a little bit. Moving out of like our school aged and younger years, we start to have adolescence, and these teenage years, people don't really understand consequences of their actions. So adolescents, really, we're looking at like our 13 to 18 year olds. They see themselves as invincible, and this can lead to problems as they're starting to learn how to drive. They're inexperienced, they're risk taking, and so we start to see vehicle accidents with young drivers. And then moving on from there, even into like early adulthood, our 20 to 40s, this is when we're most developed, if you will, kind of our healthiest period. And then we move on from there into our middle adulthood. You may start to see vision and hearing problems in this age group. We're going to start seeing our cardiovascular health decline. Respiratory systems may become weakened. Women during their late 40s and early 50s may experience menopause. Weight control becomes an issue with this middle adulthood group. And then we just move on to kind of our late adulthood. And this is really our 61 and older group. And these people become more susceptible to falls and fractures. And as their muscle mass declines, it becomes more difficult for them to balance themselves, which is why they may fall more. And then also we may start to see a little bit more of a mental decline in these older patients. So as you can see, there are many different stages, and through each of those stages of our life, our body is changing ever so slightly. And so each age group needs to be approached just a little bit differently in how we're doing our assessments. Next, we'll talk about vital signs. There's a couple of things that we most commonly look for when we're getting our vital signs. And the main things we're looking for is our pulse, which is our heart rate. We're looking for a respiratory rate and a blood pressure. So our pulse rate and our respiratory rate, we don't need any special equipment for. We can just check by feeling in one of those locations we talked about for our arteries, whether it's our radial or our carotid. We're able to feel and just count the number of heartbeats that we feel within a minute. Respiratory rate is the exact same. We just watch them and see how many times they breathe in a minute. Blood pressure is when we'll need specific equipment and we'll need to be trained on how to do that. And we will do some practice with that during our hands-on sections. There are normal vital sign ranges, but they change based on age. So here's a good little chart for you to kind of look at different vital sign ranges based on age. So our infants, these are going to be newborn to 1 year old. Children, we're going to have from ages 1 to 12. And then really anybody 12 or above, we're just looking at adult vital signs for them. So here are the normals for us. There's a couple of things that can change our vital signs. person's weight, the degree of physical activity. If you have a marathon runner and you're checking their heart rate versus checking my heart rate, there's going to be a difference in those. Their heart rate is probably going to be a lot lower. Other things that are going to change our vitals, and these are the things that we really want to pay attention to as we're doing our assessments. But our fevers, our illnesses, our pain, stress, any of those things can affect our vital signs. And that's why it's important, as we talked about in a previous chapter, that we want to trend these vital signs. We want to check it every 5 or 15 minutes so that we can see if it's getting better or worse, which would lead us to believe which would lead us down the pathway of thinking that this illness or injury is progressing and becoming worse. We're going to start into the summary. So the first system that we talked about was our respiratory system. That was our lungs and our airway, how we get oxygen in and out of our body. Next was our circulatory system. This is the pump, the heart that pumps all the blood through the pipes, which are our blood vessels. Next thing is the skeletal system, which consists of all of the bones that help us stand up and give us our form. Next, we had our muscular system. Remember, we have different types of muscles. So our voluntary muscle, the ones that we have to think about moving, those are our skeletal muscles. We have our smooth muscle, which is involuntary, and then we have our cardiac muscle. Next, we had our nervous system, which was our brain, our spinal cord, and all of the nerves that come off of there. Next, we had the digestive system, which starts with the mouth, helps us get our food into our stomach, through the esophagus, through the intestines, our liver excreting that bile to help break down the fat, and then the pancreas, which produces insulin to help us use our glucose. Genitourinary system consists of the organs of reproduction as well as the organs that are involved in excreting urine. Our skin, the next system that protects us from the environment. It regulates our temperature and transmits information from our nerves. Sensory transmits sensations and nerve impulses to the nervous system. The last thing we talked about was our vital signs and differences that can happen in different age groups of people. So our review for this one, first question, which of the following patients is in the anatomical position? A man lying down on his back with his arms across his chest. A woman standing and facing you with arms at the side and thumbs pointing outward. A child on her left side with her right knee pulled up towards her stomach. Or a man facing you with his feet 12 inches apart and his hands interlocked behind his head. And the answer is B. We have a woman standing and facing you with arms at the side and thumbs pointed outward. When referring to the human body, the term proximal means what? Closer to the point where an arm or leg is attached. A position that is closer to the feet. A position on the back of the body, or connected to the pelvis. Answer is A, closest to the point where an arm or leg is attached. Question 3. The respiratory system is responsible for transporting oxygenated blood throughout the body, ensuring that the body has an adequate supply of red blood cells, removing carbon monoxide from the body, or providing oxygen for the body and removing carbon dioxide? The answer is D, providing oxygen for the body and removing carbon dioxide. Awesome, guys. So that was chapter 6. It's a brief introduction of the human body. We're going to talk about each of those systems and some of the different developmental stages of human development as we go through more of the chapters and talk specifically about assessments and injuries and different things, and it'll all tie it together. This is just meant to kind of be an overview chapter for you. So we're doing great. Really, this is section 1. Moving on from here, we're going to start hitting different sections. So section 1 is done, you guys. You made it, and I'll see you at the next chapter.